Okay, today I'd like to talk about cerebrovascular accidents, more specifically the hemorrhagic stroke. A cerebrovascular accident, also known as a CVA or more commonly known as a stroke, is where the blood flow to the brain is disrupted. When the blood can't reach the brain, of course, the brain cannot receive the oxygen that it needs to function, and our cells start to die. There are two types of strokes, ischemic and hemorrhagic. I'll tell you a little bit about the differences. An ischemic stroke, as you see here, the picture on the left, they're the most common. They're caused by a blockage in the vessel. It's usually caused from a clot or from plaque inside of the vessel. Kind of kinks it up like kinking off the hose. Can't get any water through. Same thing with the blood. Once it closes off, can't get any blood flow to the brain. The other one is a hemorrhagic stroke, which you see here on the right. And even though it's less common, much more deadly, that one is caused from a rupture in the vessel. Basically, there's a weak spot in the vessel and it tends to blow out, or possibly the pressure, blood pressure, things like that, constantly putting a strain on the vessel will cause it to be weakened and therefore may possibly cause a hemorrhagic stroke. As far as a hemorrhagic stroke, it's also broken down into two different categories depending on where it's located. Intracerebral hemorrhages are a vessel that's burst inside of the brain that leaks out into the brain tissue, also out into the cranium, into the skull. Subarachnoid hemorrhage is a vessel that bursts and leaks out into the space between the brain and the skull. And this one will cause a lot of pressure buildup pretty quick. Both, though, of course, very dangerous. Here I want to show you, of course, the testing used to determine a stroke is usually an MRI or a CT scan. The difference is really a CT scan is practically an X-ray. The MRI can show a lot more of the soft tissue damage. And is usually more reliable, the MRI, but the CT is a lot quicker. MRI can take, up to an hour. A CT scan, like I said, is a lot like an X-ray, so it can be pretty quick. These two are a comparison, of course, of an ischemic stroke. And you see where the cells have died off here, that black spot that the arrow is pointing at. That's on the left side. And then on the right is a hemorrhagic stroke, and you can see that bright white, that active bleed that's present there. And that one's on the right. During a stroke, because the blood supply is cut off to the brain cells start to die at a rate of 2 million per minute. The average adult has around 1 billion brain cells. Besides being at risk for death due to lack of oxygen to the brain, of course, what makes a hemorrhagic stroke more deadly is the blood loss inside the cranial cavity. It causes pressure inside of the head. The blood has nowhere to go, and it starts to build up pressure inside the skull. All right. The damage caused by the loss of blood flow. You'll see in someone who is just having a stroke, you'll see these kind of things. You'll see paralysis, loss of motor function, speech impairment, vision impairment, a lot of other neurological deficits. They may be incontinent. They may have other kind of neurological things that happen where they can't control parts of their body. And that is, if there may be a clot or something like that, that may form and then pass. Of course, a TIA, that is considered. Once it passes, those functions may come back. It may be something temporary. A lot of times visual, audible impairment can be temporary. Then again, that also pertains to the type of bleed, where the bleed is, how long how long the bleed has been going on, things like that. A lot of times when the nerves are damaged, of course, even if the clot passes or, something like that, after a certain amount of time, the nerves have already been damaged. They've already been oxygen deprived. They're beyond repair. And the patient may not get, those functions back again. Of course, difficulty comprehending and formulating language, that is a major one with the stroke. It's usually one of the first things that someone will notice when someone's having a stroke. And after, of course, difficulty speaking, getting their terms out, being able to be understood. And afterwards, dysphagia, difficulty swallowing is also an issue. As far as after the stroke, again, depending on what functions have come back, there's usually a lot of physical therapy. Doctors will have the patients work with therapists, try to train their body and the parts of their brain that are still living. And, there's been a lot of cases where paraplegics walk again and they get a lot of their functions back using other parts of the brain. There's occupational and speech therapy, teaching them how to do things around their house again and cook and clean and things like that and speak, of course, and the very simple things that we take for granted, of course, they're starting over and having to try their best to do just the very smallest things. A lot of time it's strain, it's a strain on family and friends and the patient themselves. Just the frustration and having to have the care, sometimes 24-hour care, depending on the severity of the complications from the stroke. So it takes a toll on everyone, not just the patient, also the people around them. Now here's a big one. Being a medic, this is one of our major things that we've always gone over. And it's the golden hour. Everybody who's gone through medic school knows about the golden hour. That's where you hit the gas a little bit faster. So the golden hour, after the onset of the signs and symptoms, if the patient receives aggressive care within the hour, they have a much more chance of survival. We talked about before the brain cells dying. 2 million brain cells a minute. So, you got 60 minutes. I mean, that's just incredible. The amount of brain cells lost within the first hour. The signs of a stroke. It would be amazing if more people were educated on this. Signs of a stroke are facial drooping, specifically on one side. Arm drift. You have the patients hold the arms out straight in front of you, palms up. When they close their eyes, wait a few seconds, one of the arms will drift, with them not being able to physically control their arm by seeing what they're doing. Their arm will drift. And their speech, of course. You always say, can't teach an old dog new tricks. If it comes out inappropriately or slurred, very good sign that they may have had a stroke. There are many other assessments, but this is the one most commonly used. But normally you're going to know that the patient's not going to be acting right. A lot of times they can't talk at all, much less, say a simple sentence. But facial drooping is usually one of those things, and maybe, paralysis on one side or the other, not being able to move their arms or their legs on one side. That's also a good sign. If you were to see any of these things, the thing you need to do the quickest is, of course, take action. Call 911. Let them know. Try to keep track of the time that you saw this start. Keep track of that for that golden hour. They need to know, did the symptoms start an hour ago? Did they start 5 minutes ago? Their life depends on it. So taking action is the thing you need to do quickly. I do have to say, I've told my husband I would be at risk for a stroke as well because my father had one. And I've told him if he ever saw any of the symptoms to write the time on my arm, so they know when it started, because my father also had a hemorrhagic stroke. So time is crucial. That is all. I hope you liked my presentation and have a wonderful day.